Hi, good morning and good afternoon, everyone. Thanks for joining FSMA Friday, Holiday 2020 edition. My name is Aaron Bolsh. I'm the VP of Marketing for SafetyChain and the moderator for FSMA Fridays. We have a good wrap up for you looking ahead in 2021. But for those that may be joining us for the first time, what FSMA Friday is all about is an industry update. We do this monthly for food and beverage facility operators. So, your QA, your safety, and compliance professionals, anybody that's ever had to deal with an audit or certifications. This is the fun place to be. So we partner with the Acheson group to bring you presentations on a ton of different topics revolving around FSMA. And through this year, we've definitely had a big part, and we've delivered a lot of information around COVID. We thought it would be a good time to dig into that as a whole, looking ahead into 2021. So as all of our facilities kind of continue to operate under the the spike that's going on right now, and a look ahead as to operations and what's happening. So real quick, everyone is on mute. All right, but we do want to hear from you. So if you do have some questions, and I'd like to just open it up, this would be a good time to ask any personal questions about vaccinations and what that means to you personally, not just your operations. We invite all of those kinds of questions as well this time around, because I think this is something important. We do have Dr. Acheson on the phone who can help us understand that. So send us those questions. We'll get to them at the end. We're going to stay flexible with our time. We do try and stay about 30 minutes today, though, and that's what we have scheduled. With that, just want to introduce Dr. Acheson, CEO and President of the Acheson Group. 30 years experience. He's been with the FDA and the USDA, a brilliant mind, and a good partner to SafetyChain as well. So, Dr. Acheson, thanks again for joining FSMA Friday today.
Thanks, Aaron. Pleasure to be with you today. Week before Christmas and the holidays, so too bad we're continuing to talk about COVID, but it is what it is. So let's dig in and launch right into the next first introductory slide.
Absolutely. Yeah, absolutely. So first up, why don't you give us what's just kind of couple of little updates anyway for FSMA?
Yeah, FSMA continues to give us some level of news. Two quick updates. Firstly, on the product tracking rule, the proposed regulation came out quite a while ago. We've talked about it on prior FSMA Fridays. Just wanted to update people that as of yesterday, FDA updated their the comment period. It was going to be January. It's now been extended to February 22nd. So it got a little bit longer to provide comment on the product tracking rule. Second update, foreign supply verification program. Nothing updated on the regulation, but just want to remind everybody that this continues to be a significant regulatory focus from the Food and Drug Administration. Continuing drumbeat of warning letters and inspections and significant follow-up on FSVP. So if you're importing product, make sure your FSVP is current. That's an important program, and FDA is certainly focusing on it. So those are our FSMA updates. And we can probably move on to talk a little bit about what we're going to talk about in the next half hour or so. So as Aaron said, we want to talk a little bit about COVID, particularly sort of looking at not so much backwards, but forwards as to where we're headed in 2021. And I think it's fair to say that we're now seeing perhaps a light at the end of the tunnel, but as we're very much still in it. And I want to sort of really focus a bit on how do we bridge between where we are today and the future potential of vaccines becoming more widespread available. We got a little update on quarantine guidance from the CDC. I want to talk about that, some testing updates, and then we'll talk a little bit about some vaccine updates. So let's move to the next slide, please. As we look a little bit about where we are. As always, we need just to pay attention to the rapidly changing COVID situation. Things change daily, guidance changes daily, and I just want to remind everybody to feel free to leverage our resource at TAG. And to remind everyone that the fundamentals around protecting ourselves they haven't changed. And the theme of today's FSMA Friday is just to remember that as we're looking at potential vaccinations coming online more broadly into next year, the basics are still really critical. The hand washing, the face coverings, the contact surface cleanings, the social distancing, and that little graphic over there on the right is just to remind us of the importance of those things and how those are going to continue to hold us together and protect us through 2021 as vaccines begin to become more available. So let's go to the next slide. As we just sort of look at the general trends, and these two graphics are current as of yesterday, in which we're looking at daily new cases in the United States and daily deaths. This is pulled off of Worldometers, which is one of the informational sites that provides daily updates. And I just want to point out there on the graphic on the left, how we basically had 3 phases of COVID-19 disease in the United States. First one in March, April, then we flattened, then we went up again in June, July, when there were a lot of releases at the state level in terms of restrictions and opening of restaurants and other behavior changes, kind of led to that uptick. Then we flattened, and then obviously we went into this massive phase 3 or wave 3, in which the cases are running today up north of 200,000 new cases per day. Now, part of this uptick is definitely driven by more testing. And I haven't got the slide, but if you look at the amount of testing that's going on, it has gone up steadily over the course of the pandemic. That little drop a couple of weeks ago was a consequence of Thanksgiving, where there was actually quite a bit less testing that week. So the numbers dropped, but they've now taken off again. And we should anticipate that this upward trend will continue at least through the end of the year and into January. As we look at daily deaths over there on the right, clearly a very, very daunting number. And I think I just want to point out from that, even though the death rate today is significant, relative to the total numbers of cases, it isn't nearly as bad as it was. In the early part of the pandemic, the death rate was very high, up at close to 3,000 deaths per day. We are above that now, but obviously the numbers of cases per day that are being diagnosed is way higher. So it's a little bit of a glimmer of a good news. We're definitely better at handling this disease, of identifying it early. Medical professions are much better at ensuring survival, or trying to ensure survival. Let's go and move to the next. So as we sort of said, we're still in the tunnel, and this is just a little graphic showing where we are today. We've been using those really important risk prevention measures. They're going to continue to be important. There's the evolution of testing that continues to evolve as we move out to the right here. We've got vaccinations coming online, just beginning, and we'll sort of be heading into whatever the new normal talks about, which will obviously be a topic for FSMA Fridays next in 2021 as we start to adjust to all these changes. So kind of want to point out here that the situation is evolving, as if that's not obvious, and the importance of maintaining those risk prevention measures as we begin to bring in vaccinations. So let's go to the next slide. And as we sort of look at this and we sort of talk about changes, I mentioned in the introduction that there have been a few adjustments with CDC guidance. And one of the biggest adjustments is a guidance change from the CDC suggesting that it was okay to bring people back to work earlier than the 14-day standard that we've been using. And what's behind that? And I just wanted to share a little bit of the science here. What we've got on this figure is looking at the likelihood that somebody will transmit the virus. And these are really speaking to those that have no symptoms. So if you've got somebody who's an asymptomatic contact, and obviously we have many of those in the workforce, how likely is it that they will transmit the virus as the days go on from the beginning of the close contact? And I want to just draw your attention to over on the left-hand side of this graph, the risk is up there on the left. It goes up to 100% from 0. And the blue bars are just reflective of that risk. So early on in that time when you're an asymptomatic contact, the risk is up at 60% of transmitting. As you go towards day 14, it progressively drops. And by day 7, the risk is really quite low. And it does diminish a little bit beyond that. And certainly by day 10, the risk is very, very low relative to where it was early on. So it's because of these data and because of this science that the Centers for Disease Control came out and said, well, if you're tested on day 7 and the risk is you're negative, then you're okay to come back. If you don't have a test and you don't have symptoms by day 10, then the risk is really low. And it's these data that drove that. So let's move to the next slide, Aaron, in which we sort of lay out in a bit more detail what this is around this quarantine. And this is a little bit of a busy slide, but obviously you can take your time to take a look at it. But the CDC guidance is basically allowing testing or just time. So they say you can come back to work if you're a close contact, and this is just asymptomatics. You can come back to work after day 10 without testing, or after day 7 after receiving a negative test result, but the test must have occurred on day 5 or later. And this is sort of trying to balance risk, operational need, and the fact that getting somebody to quarantine for 14 days is difficult. Very important point is that states and local health departments have adopted this guidance at different levels in different jurisdictions. So it's really important that you do pay attention to what your local health department is requiring you to do. That graphic that we showed on the previous slide sort of explains a bit of the science behind that, sort of looking at how risk drops. We at TAG believe that if you're going to use this strategy, it's better to wait to day 7 for a test. CDC says it's okay to do day 5, which is fair enough. It's better to wait to day 7. And if you're going to use a test to come back, we'd prefer you use the PCR test than the rapid antigen test, just because the PCR tests are a little more sensitive. So obviously things change, but this is helpful to try to get people back sooner if they are asymptomatic contacts. Let's move to the next slide. Okay, so when to test? This is a theme that we've discussed on prior calls, prior FSMA Fridays. Obviously, there's different ways to use testing, and we've broken this into 3 groups. Individuals testing, obviously close contacts, and based on the new guidance we just talked about. There's group testing. Certainly California has pushed this pretty hard in terms of surveillance testing. Some of the push from OSHA, California OSHA, is that when you get 3 or more individuals in a facility that have tested positive in a specific time frame, then that triggers surveillance testing. Obviously, that is looking at large numbers of people very quickly to look if there's evidence of asymptomatic cases, leading obviously to exclusions. And then the third is sort of full population testing, where you're really wanting to look at the infection status of a whole population. You know, this is something that colleges and universities have done, where they're really trying to get a sense of what's there in the population. So there's different strategies to testing. You know, again, with all testing, it's important to understand how sensitive, how accurate it is that the test you're using, number 1, and then number 2, what you're going to do with the data and the impact of that and the results. So the big part of our role is helping people to sort of navigate through this increasingly complex testing protocols as more tests come online and as new tests are available. And I'm sure many of you have seen there are now tests that are going to be available in supermarkets where you can buy a test, you can administer it to yourself at home. You don't have to send it in. You get the result in about 20 minutes. So we are definitely going to see more and more and more testing coming online as we move into 2021. So let's move on, Aaron, to the next slide here as we sort of think about how we're headed into the next year. And I want to sort of move into the vaccine story and look a little bit at that. Obviously, that is a huge part of where we're headed in 2021. Just to remind everybody, Pfizer received its emergency use authorization, or EUA, from the FDA on December the 11th. That vaccine is already being used. It was approved in the UK about a week prior to the US. The data on that shows that that vaccine is about 95% effective after two doses. Those doses have to be 21 days apart. And that 95% effectiveness is based on phase 3 studies conducted by Pfizer, in which they basically did a study of about 44,000 people. Half of them got the vaccine and half of them didn't. And they tracked those two groups over 2 months and showed there was about a 95% protection. Not 100%. There were people who were vaccinated who got COVID. Generally, the disease was less severe. That's good. Right behind Pfizer is Moderna. That vaccine, real time, was looked at by the advisory committee at FDA yesterday, and it got a thumbs up from the advisory committee. Now, that does not mean FDA approval. FDA have to sort of look at the advisory committee comments and make a decision. But I would anticipate that it will get its EUA today. I think before the day's out, we will see a formal announcement from the FDA that that's approved. It tracks very much like Pfizer, about 95% effective, with a sort of similar profile of minor side effects. Both of these vaccines are based on messenger RNA packaged in a liposomal nanoparticle packet. And essentially the way they work is that when you inject them into your arm, it has to be an intramuscular injection. The cells in your muscle take up the mRNA, messenger RNA, and they translate that, your cells translate that into specific surface proteins called spike proteins that I'm sure many of you heard of. So you've got your own body making these surface proteins that are typically seen on the virus. And that stimulates an immune system to those spike proteins, which are then considered to be effective in protecting you. What we do not know yet is exactly how good the vaccine is in terms of protecting you from spread of the virus if you're asymptomatic. So in other words, if you've been vaccinated, then you get exposed. Are you able to spread it? We don't know. How long will the immunity last? We don't know. So still much to learn as these vaccines roll out. There's quite a lot of noise and chatter about two other vaccine candidates that were that came out quite a long time ago in China and Russia, currently in phase 3 trials. They're supposed to be in the 90% or so effective. They are using a different approach. They're using adenoviruses to move to basically to provide the signal to the body to make these the antibodies against the SARS-CoV-2, the COVID-19 virus. So it's a slightly different approach. Not much information available yet on these, particularly with safety and efficacy. So, you know, the Pfizer and the Moderna vaccines are the two that are going to be out there, head and shoulders of everybody else. That's what's going to be distributed across the United States. Pfizer, just as I'm sure many of you are aware, requires a very sophisticated cold chain. It's got to be kept very cold up until the point at which you reconstitute it ready for administration. And by very cold, I'm talking about -70 Celsius, so very cold. Moderna has the advantage that it doesn't need to be quite so cold. A regular commercial freezer will suffice for the Moderna vaccine, so it's a little bit more stable, which makes cold chain and transportation logistically a little easier. Let's go on, Aaron, to the next slide. So linking this all together with a little bit of vaccine there on vaccine background, hopefully that I've emphasized, but I want to re-emphasize that as these vaccines come online, we're still going to have to practice the risk reduction strategies, the mask wearing, the physical distancing, the face coverings, etc. after vaccination. We assume that those who are vaccinated are not going to carry as much of the virus and hopefully not carry it at all, but they could still potentially transmit the virus. I think we have to assume that at least through the early part of 2021, as vaccines become more prevalent, more people take them, that our social distancing practices, what do you do if you don't feel well practices, et cetera, really will not change. I think it would be a mistake for entities to say, okay, we've now vaccinated everybody, we can ditch the personal protective equipment, we can ditch the hand washing. We just don't know yet as to whether that's a wise move. And right now, I think it's not a wise move. And my advice very strongly is we should not change any of that. And certainly if somebody has been vaccinated and gets symptoms of fever and aches and pains and a cough and etc., we shouldn't assume that it's something else. We should still take the precautions and frankly, I believe, still exclude them for now. We have much to learn about how quickly and how assuredly we can move away from the controls that we've been using since February. Based on other vaccines, viruses, we're hoping that the immunity will last a good while with 2 doses. But as I said earlier, we know it works for a couple of months, but we don't know beyond that. So as I said, much to learn on the vaccines as we move forward, and it's an important thing to stay tuned into. Let's go to the next slide. So another big part of vaccines is who's going to get them. And as we look at that, there are groups at CDC that have been designating priorities, and they come up with different groups, 1A, 1B, and 1C. Group 1A gets vaccinated first, and they're essentially healthcare workers and those in long-term care facilities, because either the exposure is high or the risk of serious illness is high, and makes total sense. They're in this first group to get vaccinated, and those are the ones that are being vaccinated right now. 1B is the next group, which are essentially the critical infrastructure individuals. And when you look at the total number of critical infrastructure people in the United States, it's about 87 million. So that includes food and ag sector, it includes food workers, it includes everybody growing food, making food, shipping food, all the support services, retail, restaurant. So that's the whole food sector, and it includes everybody else who's part of critical infrastructure. So part of maintaining national security, phone systems, electric systems, utilities, transportation, roads, you name it, as well as emergency support, first responders, et cetera, et cetera, et cetera. So this is a very, very large group, and there's conversations going on right now about, well, how do we prioritize within this group? So again, a space to watch. Where will the food and ag sector come out? And within the food and ag sector, will that be further sort of bracketed into high risk, medium risk, low risk food ag sector individuals as we work through this? So that's definitely something to keep an eye on. Contraindications for the vaccines. We have already seen unexpected allergic reactions to the vaccine. In the UK, a couple of people had allergic reactions, quite severe. So far in the US, I'm aware of 2. Both occurred in Alaska. One was severe, one was less severe. And that basically has driven people to recommend, the government to recommend that if you're going to get, if you're a candidate for the vaccine and you have prior history of allergies, to be very careful or not to take it. And secondly, for the vaccinations to be done in facilities where there is capabilities for resuscitation should you need it. Sounds a little scary, but we're learning. We're absolutely learning, and we shouldn't take unnecessary risks. Obviously, we've got other vaccines that are in the wings moving along, and we can anticipate that they will be coming online early next year. But as I've said, the Pfizer and the Moderna vaccines are the ones that are out in front and are going to be administered and are being administered right now. So still lots of moving parts around vaccinations. So let's go to the next slide, please. We believe that employers do have an important role in this whole vaccination effort. As some of you may have seen, there was just a very new information from EEOC essentially saying that employers can mandate the vaccine if they wish. Now, that doesn't mean they should. And I think that I would recommend that anybody who's thinking about this give this very, very serious consideration. But it would appear that legally that one can mandate the vaccine. I think food companies up and down the supply chain are really in a unique position. Generally, companies have become a trusted source of information, and I think employees are looking for companies for information, not just around personal protective equipment and hand washing and training and education, but also what to do about vaccines. So staying current in this space is going to be important, and I think that that's again is going to be a very key area to stay current on. And as I've said, this scenario is changing almost daily as we're learning more about vaccines and the pros and the cons around vaccinations. Let's go to the next slide.
You bet.
This message really speaks to this trust issue. There's many questions around vaccination, and these questions are only going to become more prevalent in the coming weeks and months as we move into 2021. We do need to sort of rely on pro-social behavior, looking at sharing information, talking about what's important, talking about what's current, being very transparent. And I think that sort of circles me back to questions that we've already had around, well, what do we know about the Chinese vaccine and the Russia vaccine? And the answer is very little. And we certainly need to learn more about those, before we would sort of get to a point of saying the data supports them being equally as effective and as safe as Pfizer and Moderna. So this whole part of communication and trust with our employees remains critical and very important. And right now, vaccines are front and center in terms of what you're going to do and how you're going to do it, and sharing that information. Let's move to the next slide, please, Aaron.
Yeah, I think we're wrapping up. We got about 2 minutes left, Dr. Acheson, and we got a couple of questions. So I think we should move straight into those, and we'll keep it right to that half hour. I know that people are probably eager to maybe get a little work done, maybe get to the weekend. So one question, pretty interesting question. So Yvonne asks, there are exceptions for office workers in Group 1B for food and ag sector that work remotely. The question is, what if some of those employees still come into the food manufacturing plant for essential work and tasks? Should they get the vaccine as Group 1B, and who decides this? I think this is an opinion, but then the second question there is, who's mandate? Do we know who governs that the decision-making process as the vaccines roll out?
Yeah, I think that this it's a great question, and I think the hierarchy whereby people will get vaccines is very much up in the air. The decision for that, I think there's guidance going to be created at the federal level. I think ultimately the decision around that will lie heavily with states and with locals potentially. So keeping track of where your state is and what your local authority is recommending, allowing, is going to be really important. Definitely, there's every which way to slice this. Those that are in manufacturing facilities where social distancing is difficult, obviously are a higher priority than others that are in different situations. that particular group of office workers that are fall into a lower category. I mean, to that question, there's a way to slice and dice that too, where you've got individuals who basically are at home, working from home, remote, low risk. You've got individuals that are doing some of that and coming into the plant, medium risk. You've got those that are in the plant all the time, higher risk, higher priority, I should say. So I think this is a very, very dynamic scenario, and we just got to watch it and try and apply some logic to the order in which people get prioritized for vaccination. But it's like it's just moving, Aaron. It's just moving constantly, and we need to keep watching it where it goes.
Yeah, absolutely. So a couple other questions. One, I think, comes through as an, as the self-tests start to hit shelves, I think that there might be some smaller plants out there that are wondering, boy, should I just grab some of those just to, to add to that strategy of being able to test effectively and so forth. The question is, do we have any knowledge of the self-test efficacy rates? And my guess, Dr. Acheson, is that might have stemmed from a tweet or two from the CEO of Tesla a while back. Any knowledge there that you can?
Yeah, we did look into this. The test, the one that was approved this week from FDA for what you might call home use, off-the-shelf purchase, it does appear to be pretty sensitive. The studies on that show that certainly if you're in like the symptomatic part of this, or your viral load is pretty high, you're going to wind up with a 94-95% accuracy on this test in terms of both sensitivity and specificity. So it's pretty good. And like every test, if you test too early, you're going to get a false negative. So it does depend a little bit on the timing, but compared with other antigen tests that are out there, it matches up pretty well. And I was a bit skeptical at first that it was going to be not very accurate, but the data so far would support it being fairly robust. I think grabbing some, buying them, using them to help manage risk in a plant, there's nothing wrong with that. Certainly that is a strategy, but we've said this since the beginning of the pandemic. If you're going to do testing, then do figure out what you're going to do with the positives and how to message it for the employees. We've done a really good job at maintaining that transmission of information, that communication. The confidence in many companies has remained solid, and that's something that we've got to continue to safeguard and protect, because we're not out of the tunnel. It may look like we're headed in a good direction, and I really believe we are, but we must maintain focus, and we're hoping the vaccines will be the saviors. But even if they are, we're months away from that. Just logistically, to get enough doses, vaccinate enough people to truly have the vaccine change the curve here, Aaron, is a ways out. So all of the old, they sound old, but all of these basic strategies, including testing, are going to be integral to keeping us on the right trajectory over the next 3, 4, 5 months.
Okay. And then one last question here. The Pfizer looked like there was an age limit on it of, I believe the slide showed 16.
Yeah, that's right, 16.
Do we know, is there one for Moderna? Is there an age limit?
Off the top of my head, I want to say I think it's 18, but I could be wrong. I could be wrong on that. One of the common question while we're just on this that has come up repeatedly with us is it okay if you're pregnant to take the vaccine? And there's no data on that. Pfizer have specifically said they didn't administer the vaccine to pregnant women. Pregnant women were excluded from the study. It's a whole study group that has not been looked at. So their recommendation, Pfizer's recommendation, is not to give this to people who are pregnant. And I say that just because, obviously it applies to a lot of the population, and it's a question we've been getting at TAG quite a bit.
Got it. Okay. Well, just as a reminder, oftentimes we look at the last global pandemic, which was about 100 years ago. That lasted 2 years. So, you know, and there was a fourth wave. I'm not saying that this is bad. I believe I believe the same thing you believe, which we do see the light at the end of the tunnel, Dr. Acheson. We are getting better. We have to keep practicing the safety measures that are keeping us from getting worse, right? So, and I think it's just kind of, you know, we'll keep tabs on this as we get into 2021, and we appreciate you always, as always, joining us, Dr. Acheson. We've got another couple of things coming up in January. We've got one at GFSI for FSMA Friday. I don't have that up here, but I did just want to say we do have SQF Edition 9 tips for your conversion plan. We're going to be meeting with Luann Chuboff, the VP of Technical Affairs of SQFI. Check that out. As always, Acheson, you've got some great resources over on the achesongroup.com. I really like that that poster that you guys made about the masks and so forth. So, and that's for everyone to use as well. So, I did want to also thank one person that through the entire year 2020 we don't talk about a lot. Her name's Ann Grace. None of us ever see her. She is behind the scenes and she runs FSMA Fridays like a champ. And I just wanted to reach out, just give her a shout out. She's on the SafetyChain team and she's an absolute wizard when it comes to these webinars. So, and she's the driving force behind why we're able to get the recordings and all of this stuff out to our registrants so quickly. So thank you, Anne, as well for all your help through this year. So, and we're looking forward to another sprightly year in 2021 as we turn the corner and get out of this mess. Right, Dr. Acheson?
Right. Getting out of this mess is exactly right. And we'll only get out of it if we continue to focus on doing things properly. So, no, great opportunity. Thank you. Thank you for those who joined us today.
Yeah. All right. Well, happy holidays to everyone. Stay safe out there. We'll see you next year. Thanks, Dr. Acheson.
Thank you.